today. And that is the amazing power of regenerative medicine. Most people don't understand what regenerative medicine is. They have been taught the wrong things, or they haven't had the time to read about or learn about how our body can regenerate and heal itself. We literally have almost all the tools we need to have a life well lived. They just need to be put in the right place. So today I want to talk a little bit, for a short amount of time, about something called PRP. Now, you may have heard of PRP, you may have ideas of PRP, you may have heard of the vampire facial, where they stick you full of blood, your own blood. And what are they injecting with? They're injecting with something called platelet-rich plasma, PRP. Well, I want to talk to you about this because I think it's really important. You need to understand that our blood has lots of different components in it. It's got platelets, it's got white blood cells, it has red blood cells, it has proteins, it has plasma. And just recently, we have now real hard data indicating we have free, circulating, cell-free mitochondria running through our bloodstream, coursing through our veins and arteries, not attached inside any cell. And so it's mind-blowing because when I was in medical school, we weren't taught that. When I was in medical school, we were also taught that part of DNA is just junk. We throw it away. That's wrong too. And so we need to understand that every year as we learn more, we gain more insight into the science of healing. One of those really insight-gaining modalities is called PRP. Platelet-rich plasma. Well, how do we know that it's platelet-rich? There is only one way to know how platelets are rich in plasma. We have to measure them. And so at our offices at Concierge Medical Associates, we run platelet counts on our samples. And there's just no other way to do it. If you go to a dermatologist, an esthetician, I had a patient the other day who has horrible rotator cuff tears from going indoor skydiving. They ripped their shoulders back and they had horrible tears. They had labral tears, they had supraspinatus tears. And I told them our price, and it was too much for the patient, unfortunately. And so she went to an esthetician, right? What's an esthetician? That's someone who trains in giving you a facial massage, someone who trains in helping pop your follicles and your acne out. And there's a lot of other things estheticians do, but one thing they don't do is they're not licensed to inject PRP in anyone in the state of New York or Connecticut. Guess what? Her esthetician gave her PRP in her shoulders. Did they measure what it was? No. Was it even the right concentration? They had no clue. Did they even know where they were injecting it? The answer is no. And so I bring this up much like the hyperbaric oxygen childhood death from that accident where they were charged with murder. Estheticians will tell you they're giving you PRP without ever measuring it. And that's dangerous. The title of this is PRP works to heal knee pain. It also works to heal shoulder pain. It also works to repair tendons. But you have to know where you're injecting it. You can't just stick a needle. The same thing is true in facial aesthetics these days. You inject Botox or you inject fillers or these types of things. There's all sorts of blood vessels in our face. And you could end up injecting filler into a blood vessel. And that's dangerous. You could infarct your whole face. So you need to use ultrasound guidance. I don't know if you can see it over here. Let me show you. Right, so right there is a meniscus. That's a meniscus of someone. And if you haven't looked at ultrasounds, you have no clue what this is. So you have to go to school, you have to learn. And we all learn how to do point of care ultrasound for injection guidance, right? I think that's a pretty good image there. So one of the most important things is if you're going to get injections in your face, in your shoulders, in your knees, you better use ultrasound guidance. That's number one. Number two, you should not go to an esthetician for which does a face and does laser or massage or creams or peels. You don't let them stick a needle in you, even if they say they're good, because they're not licensed. What happens when they hit a blood vessel? And what happens when they don't use ultrasound? Can you sue them? Well, good luck. They don't carry malpractice. So number one, quick tips. Dr. Murphy's quick tips for PRP. If you're going to get an injection for PRP, make sure it's from a licensed provider, number one, who's got malpractice in case they mess up. Number two, when you get PRP, platelet-rich plasma, make sure that they're checking the platelet counts. PRP is excellent for knees, for meniscus and arthritis, but the literature shows you have to have billions of platelets. Billions with a B, not millions, billions per injection to have an effect. I wrote a book about this called Heal Smarter, and it highlights the importance of using the proper dose of PRP. So you have to measure PRP. That's number two. Number three, do they know where they're injecting it? One of the powers of longevity medicine and regenerative medicine is being able to let your body heal itself by putting your own healing tools back into your body where they belong, like in the meniscus over there. So how do I know I'm in the meniscus? Well, I can fuddle around and push and shove, but only with ultrasound injection are you going to truly know you're in the right spot with the right therapy. Measure it, okay? Track it, and use ultrasound guidance, whether it's in your face or in your knee. PRP deserves that. You deserve that. So use these quick tips. Are you licensed? Are you measuring it? And do you know where the hell you're injecting it every time you get PRP? All right. Hopefully that's a quick tip for the day and you learned a little bit. Have a great day and have a life well lived.